Lactose intolerance, milk allergy. What differences? Unlike cow's milk protein allergy, with which it is often confused, lactose intolerance mainly affects adult. Cow's milk protein allergy is the first food allergy to appear in children. 2 to 3% of infants before the age of 2 are affected. As with any allergy, this is an inappropriate response of the immune system to non-aggressive substances normally present in the environment, allergen. This pathology results in very varied signs such as eczema, hives, edema, colic, diarrhea, asthma, explains Professor Gisèle Kanny, allergist at Nancy Hospital. When the allergy is proven, which necessarily requires carrying out skin tests performed by an allergist, all traces of milk must be removed from the child's diet for a period of a few months. An approach to practice with a dietitian in order to avoid food imbalances or cross-allergy. After this period of elimination, the allergist gradually reintroduces milk into the diet with the aim of reverting the immune system to tolerance. All this is done under medical supervision because the risk of anaphylactic shock, which can be fatal, is real, continues Professor Gisèle Kanny. Intolerance, enzyme deficiency. After the age of 6, the majority of milk allergies dissipate. This is why we encounter very few of them in adult. However, it is not totally impossible. We have, for example, seen allergic reactions in athletes who swallowed high-protein diet supplements, concentrated in milk proteins, emphasizes the specialist. But then, if allergies are rare, how to explain that many adults complain of gastrointestinal disorders when they swallow milk? This is simply because they are not allergic, but intolerant to lactose, the main sugar in milk. The food in question and the symptoms are identical, but the mechanisms involved have nothing to do with those of allergy. In lactose intolerance, you can't stand milk because of a lack of lactase, a digestive enzyme that degrades this sugar, explains Professor Gisèle Kanny. Cheeses and yogurt. In France, 30 to 50% of adults have incomplete digestion of lactose because, in most humans and almost all mammals, lactase activity decreases rapidly after weaning. Lactose intolerance is common and can be particularly uncomfortable, but it is not life-threatening. To avoid digestive disorders, simply avoid the consumption of fresh milk and prefer milk with a reduced lactose content, or even hard cheeses and yogurt. The digestion of semi-solid foods, yogurts, or solids, cheeses, is slower than that of milk and promotes digestio. Above all, it is advisable not to remove dairy products from your diet because they provide important nutrients such as calcium and vitamin. In addition, if ever the digestive disorders were caused by an allergic reaction, a removal of dairy products could aggravate the clinical expression of the allergy, insists Professor Kanny. The doctor strongly recommends that people who suspect a digestive allergy or intolerance to milk consult an allergist before upsetting their diet.